Hello, my name is Mitchell Gavecci, and my project is over the connection between lack of sleep and diabetes. So first let's go over diabetes, which is a chronic health condition that affects how your body turns food into energy. Most of what you eat is broken down into glucose and released into your bloodstream, signaling your pancreas to release the hormone insulin. Insulin then acts like a key to let blood sugar into your body's cells to use for energy. If you have diabetes, your body either doesn't make enough insulin, which is type 1, or you can't use the insulin it makes as well as it should, which is type 2. When there isn't enough insulin or the cells stop responding to insulin, too much blood sugar stays into your bloodstream. Over time, this can cause serious health problems such as heart disease, vision loss, and kidney disease. Let's talk about those two types. Type 1 is usually diagnosed in children, teens, and young adults, but it can develop at any time. Because of an autoimmune reaction, the pancreas does not make enough insulin, or it makes very little. With little to no insulin, blood sugar is unable to enter cells, therefore building up in the bloodstream. High sugar accumulation contributes to symptom progression and other complications. Diabetes type 1 is less common than diabetes type 2. It's actually about 5% of people who have been diagnosed with diabetes have type 1. Currently, no one knows how to prevent type 1, but it can be managed by following your doctor's recommendations for living a healthy lifestyle, controlling your blood sugar, getting regular health checkups, and getting diabetes self-management education. So type 2 is a more common diabetes and affects 95% of individuals that have been diagnosed with diabetes. Type 2 is when the insulin in your body becomes ineffective and can't keep the blood sugar at normal levels. The cells in your body develop insulin resistance, making your pancreas create more insulin to try and get the cells to respond. Eventually, the pancreas becomes exhausted and blood sugar rises. Type 2 develops over time and takes many years and is usually diagnosed in adults. It can be managed by the patient with support from a healthcare provider. Healthy eating, being active, prescription insulin, and other injectable medications help control blood sugar levels to avoid further complications. A third type of diabetes is called gestational diabetes, which develops in pregnant women who have never had diabetes. If you have gestational diabetes, your baby could be at higher risk for health problems. Gestational diabetes usually goes away after your baby is born, but increases your risk for type 2 diabetes later in life. Your baby is also more likely to have obesity as a child or teen, and more likely to develop type 2 diabetes later in life also. So let's look at diabetes prevalence in the United States. About 30 million individuals, or 9.4% of the American population, suffers from or has been diagnosed with diabetes. 5% of that 30 million are presumed to have diabetes type 1, and over 84 million of those have been diagnosed with prediabetes. Prediabetes is a condition that, if not treated, often leads to type 2 within 5 years. 1.5 million new cases of diabetes are diagnosed every year. Studies show that the rates of diabetes vary by ethnic background and also increase with age. So this graph shows the prevalence of diabetes in relation to ethnic background. We show that the most affected group of individuals are American Indians or Alaska Natives at 5.1%. Second would be African Americans at 12.7%. Third, Hispanics at 12.1%. Then Asian Americans at 8%. Lastly would be white individuals who are at least risk for contracting diabetes, which is at 7.4%. And the variance between men and women are very little, as women are 10.86% at risk and men are at 11% at risk. This slide shows diabetes prevalence in relation to age, and we can see ages 18 to 44 have the lowest diagnosed occurrences of diabetes at 4%. Ages 45 to 60 is 64%. We have 17% of those individuals, or 17% of individuals diagnosed with diabetes are between those ages, and 25% of individuals diagnosed with diabetes are 65 and older. Diabetes prevalence has also varied significantly by education. For example, among U.S. adults with less than a high school education, 12.6% of them had diabetes, or 12.6% of them had diabetes. Those with a high school education, 9.5% of them had diabetes. And individuals with more than a high school education had 7.2% diabetes. So you can see the risk for contracting diabetes becomes less and less as education is pursued. So what are some risk factors for diabetes? Well, it can actually literally affect anyone, so getting to know these risk factors could help in the prevention of prediabetes or contracting diabetes type 2. Those risk factors include being overweight or obese, leading a sedentary or inactive lifestyle where you're physically active less than 3 times a week, being above the age of 40 or 45 years old, having a parent, brother, or sister with diabetes, or having ever had gestational diabetes or given birth to a baby who weighed more than 9 pounds. Another one would be of being a genetic background that is at higher risk for diabetes, like those American Indians, Alaskan Natives, African Americans, Hispanic, or Latin Americans. So let's switch subjects and talk about sleep. Well, sleep actually plays a vital role in good health and well-being throughout your life. Getting enough quality sleep at times can help protect your mental health, physical health, quality of life, and safety. The way you feel while you're awake depends in part on what happens while you're sleeping. During sleep, your body is working to support healthy brain function, maintain your physical health. In children and teens, sleep also helps support growth and development. Studies show that a good night's sleep helps improve learning. Whether you're learning math or learning how to drive a car, it helps enhance your learning and problem-solving skills. Sleep also helps you pay attention, make decisions, and be creative. It's also involved in healing and repair of your heart and blood vessels, as well as helping to regulate inflammation all over your body. Other studies have found sleep to affect an individual's ability to interact socially, showing that proper sleep is associated with the ability to correctly recognize facial expressions and even pick up on social cues. So how much sleep is enough sleep? Well, the amount of sleep you need will most likely change over the course of your life. And although sleep needs vary from person to person, there are general recommendations for a good amount of sleep depending on your age. So you have to ask yourself, do you regularly have difficulty getting to sleep or staying asleep? Do you need caffeinated beverages to keep you going throughout the day? Do you feel like taking naps throughout most of the day? Or do you feel tired? Or do individuals tell you that you look tired? Well, if you answered yes to any of these questions, then you probably should think about your sleep, or you probably should talk about your sleep with your physician or some sort of sleep clinic to evaluate your sleep patterns or possible sleep disorders. Because bad sleep habits and long-term sleep loss will affect your health. The CDC has estimated that 1/3 of the U.S. population is not getting the recommended amount of daily sleep. Chronic sleep deprivation is becoming an increasingly common phenomenon in our modern 24-hour society. And it's mainly due to voluntary sleep restriction and increasing work demands. Restrictive sleep does not only result in sleepiness and impaired cognitive performance, it also adversely affects your overall general health. Getting enough sleep is not a luxury. It's something that people need to do for good health. Sleep deficiency can increase a person's risk of chronic health problems, and the damage from sleep deficiency can occur in an instant, or it can harm you over time throughout your life. It can also affect how well you think, react, work, and learn. Poor sleep is strongly linked to weight gain. People with short sleep duration tend to weigh significantly more than those who get adequate sleep. In fact, short sleep duration is one of the strongest risk factors for obesity. In one extensive review study, children and adults with short sleep duration were at an 89 and 55% more likely to become obese. Sleep also helps maintain balance of healthy hormones that make you feel hungry, like ghrelin, or full, like leptin. When you don't get enough sleep, your levels of ghrelin go up and your levels of leptin go down. Ongoing sleep deficiency is linked to an increase of heart disease, kidney disease, blood pressure, and also stroke. Studies show that sleep deficiency alters activity in some parts of the brain, and if you're sleep deficient, you may have trouble making decisions, solving simple problems, controlling your emotions and behavior, and even coping with change or having a hard time adapting. Sleep deficiency has also been linked to things like depression, suicide, and risk-taking behavior. As a result, sleep deficiency is not only harmful on a personal level, but it can also cause large-scale damage. For example, sleep deficiency has played a role in human errors linked to tragic accidents, such as nuclear reactor meltdowns, grounding of large ships, and even aviation accidents. So let's talk about how sleep let's talk about how sleep correlates to diabetes prevalence and risk. It affects how your body reacts to insulin, which is the hormone that controls your blood glucose and sugar levels. Sleep deficiency results in a higher than normal blood sugar level, which may increase your risk for diabetes. Multiple studies have shown that the association between the risk of contracting diabetes type 2 and sleep deprivation. Lack of sleep triggers the stress response, therefore triggering the heightened cortisol production in the body, which releases glucose to maintain blood sugar in the bloodstream. Insulin, in consequence, is released to allow for the glucose pathways to open up and absorb that glucose. Over time, this persistent behavior of sleep restriction in the body develops insensitivities to those chemicals constantly being released. A recent study in the Cleveland Clinical Journal of Medicine concluded that although serum glucose levels were shown to decline throughout sleep-restrictive hours, insulin production levels would still rise consistently, indicating that the body was becoming less sensitive to insulin. The same study also states that individuals who are sleeping less than 7 hours a night are at risk for prediabetes or a glucose metabolic disorder. Another study by the Center for Disease Control found out that the consistent rise of glucose in the bloodstream as a result of chronic stress induced from lack of sleep causes beta cells in the pancreas to become less tolerant to rising glucose levels, as did fat cells that absorb glucose became less sensitive to insulin. It also found that melatonin, a hormone which is produced during sleep and produced during getting ready for sleep, helps the pancreas regulate these beta cells and regulates the release of insulin throughout the night. So it shows that a disordered sleep habit or disordered sleep routine disrupts melatonin production, therefore disrupting insulin release through the pancreas. So I guess the biggest takeaway from these studies would be to, in order to avoid chronic disease or the risk and prevalence of diabetes type 2, getting a proper amount of sleep is necessary and critical towards preventing these diseases.